I'm Dr. Michael Seidman. I've been in the North Country for over 35 years. I've spent all that time working at Claxton Hepburn Hospital. I've done primary care internal medicine, nephrology. I'm chief of medicine. I'm the medical director of the Agawam Renal Center. We read every day, and us who are involved, and we're always reading stories about how this whole process is going. So this is how things really happened in New York City. There was a long period of time where there was no immediacy, where people didn't see, they weren't ICUs full, they weren't people dying by droves. This accelerated very, very, very rapidly. And the point was, no one took it seriously until they were sick and dying people that totally overwhelmed the healthcare system. And it's because people really sometimes need to see things with their eyes, and they want to be an optimist and hope for the best. Is it possible that this gets overwhelmed? It's possible, but again, this is, going to be to some degree preventable by how people conduct themselves on a day-by-day basis. Not to take the appropriate measures to isolate yourself and protect yourself is not a personal statement about you wanting to take your chances and that you'll let the chips fall where they may. What it actually is a statement that you're willing to put those around you in the community at risk for them becoming ill and a much bigger problem than this needs to be. So the idea is not when this is over. The idea is take each day as it comes. We're a strong country. We have a lot of resources. People are on hard times, but here in New York State, you have organization here that's going to deal with this as best they can. We want to come out of this safely also. So understand that as we come out of this, it isn't like one day it's going to be business as usual. Things have to be in place to prevent this from rebounding. And from what we've seen around the world, if you do things too quickly and without the proper protection and without available testing and without available resources, we can get this whole thing going. If you ask people when this is going to end, you'll hear a lot of guesses and a lot of opinions, but the only answer is no one really knows. No one knows when this is going to end. I think what we do know is, and it's happened so far up here, if you do the right thing and hang in there, in the long run, it's going to be okay. And you can, through your personal actions, change what happens in this community and lessen the impact for yourself, your family, and the community on a whole.